Right now, there is a massive conversation happening around modern weight loss medications, often referred to as GLP-1 therapies. Patients often ask me, should I try the injections or do I need a gastric sleeve? And as a surgeon, my answer usually surprises them, because it's not about choosing sides. It's about understanding that obesity is a complex chronic disease. Today, we're going to look at both medical weight loss and bariatric surgery, how they actually work, the risks of both, and how in modern medicine they are designed to work together. Welcome back to the channel. I'm Dr. Ashok Gunawardene, a general surgeon with an interest in weight management and metabolic health based here in Melbourne. Before we begin, a quick reminder that this video is for educational purposes only. Every patient is unique, outcomes vary, and all medical and surgical treatments carry risk. This does not replace a formal consultation. And let's start by looking at medical weight loss. In recent years, prescription weight loss medications have completely changed the landscape of obesity management. While I cannot use specific brand names due to Australian regulations, you likely know these as GLP-1 therapies or daily and weekly injectables. How do they work? These medications mimic a hormone naturally produced in your gut. They target the appetite centers in your brain to reduce hunger, and they slow down how quickly your stomach empties, keeping you feeling fuller for longer. They also help to prevent spikes in blood glucose by stimulating the pancreas to release insulin at the right time. These medications are an excellent tool. Clinical trials show they can help patients lose around 15 to 25% of their body weight, depending on the drug and the dose. However, because obesity is a chronic condition, ongoing treatment is usually required. Stopping the drug commonly leads to partial or full weight regain. They also carry risks. Side effects most commonly include gastrointestinal issues like nausea, vomiting, or constipation. There are also rare but serious risks, and these medications are contraindicated for some patients. For example, those with certain thyroid conditions. So specialist supervision is important. Furthermore, without a strict protein diet and resistance training, you risk losing valuable muscle mass along with the fat. Now let's talk about bariatric surgery, such as the gastric sleeve or gastric bypass. Generally, this is for patients with a BMI of 40 or higher, or a BMI of 35 with obesity-related conditions, and is increasingly considered for a BMI of 30 to 34.9 with significant metabolic disease. Surgery remains the most effective long-term treatment for severe obesity. Surgery does two things. Firstly, it physically restricts the amount of food you can eat. But more importantly, it changes gut hormones and appetite signaling, which often leads to much less hunger and blood sugar control. The data on surgery spans decades. It offers the most durable results, often resulting in around 25 to 30% total weight loss, long-term for common procedures, sleeve and gastric bypass. It also leads to high rates of remission for type 2 diabetes for many patients. But surgery is a major physical and mental commitment. It involves permanent anatomical changes and surgical risks such as bleeding, infection, or leaks. It also requires a lifelong commitment to taking specific vitamins and getting regular blood tests. This need is stronger after a bypass than a sleeve, but both require strict monitoring. So which one is right for you? In a modern, comprehensive clinic, we don't view them as competitors. We use them as a combined toolkit. We also have to discuss the practicalities of cost. GLP-1 medications involve an ongoing high cost, whereas surgery has a high upfront cost, but is often more cost-effective long-term. Clinically, they work beautifully together. They often use these medications before surgery to reduce weight and shrink the liver, which may make the operation technically easier and safer. The research is still evolving. On the other end of the spectrum, if a patient experiences weight regain years after a gastric sleeve, we can now introduce these modern medications to help them lose that regained weight and improve metabolic health again. This allows us to often avoid or delay a second higher risk revisional operation. There is no single best option. There is only the best option for you. Obesity is a complex disease, and you deserve a specialist who looks at the whole picture. If you found this video helpful, Please hit the subscribe button so you don't miss our next deep dive into metabolic health. If you're in Melbourne and want to discuss your specific situation, my team and I would be happy to help. You can find the link to book a consultation in the description below. Thank you for watching, and I'll see you in the next video.